woke up April 2nd, and I knew it wasn't good, and that's when I called the ambulance. And after that, truthfully, I don't remember a lot. I kind of remember I was in this room. There was people in yellow gowns, and they looked like they were ready to take off for the moon. And after that, it's just like I'm gone. When I found out what the date was, when I woke up, it was unbelievable. I could not believe I had missed Palm Sunday, Easter. All that was behind me. I was just so grateful to still be here. Blessing Hospital, absolutely, without a doubt in my mind, saved my life. I was anxious to go home, but believe it or not, it was hard to tell them goodbye because they did a lot for me.
When COVID first started here, my thought was, I hope we don't have to start wearing masks.
I'll be honest, in the beginning I thought, oh, they'll never get here.
Maybe it may miss us. Maybe in the Midwest will be a little different. On another note, I was very worried because if it does hit, I'm in the forefront of it.
I don't think we really could have anticipated what we were going to run into.
I remember the beginnings of COVID and how it affected us at Blessing Hospital. It became a quick reality.
I remember the first case here and just being terrified of what we didn't know.
It was the first time in my life I've kind of been scared of my job in a way. It's almost survival mode, you know, you're just trying to do what's right.
We exhausted all efforts for everyone, but there were just so many times that it just didn't work. It was draining.
I think the more challenging thing in some cases wasn't so much the patient as much as the families. I remember a guy we had whose family hadn't seen him. We got them in there to see him before he died, and they thought they walked into the wrong room.
We had patients who had no visitors, no family. They were completely alone and isolated, and it's a scary situation anyway.
And so we instantly became their family.
I remember so many times, like the big thing was, you don't want your patient to die alone.
I feel for the nurses. I know there was a group of nurses that had to go in one room. That person coded and died, left the room, had to go in another room, I mean, within 10 minutes, and deal with another person that coded and died. You can be as strong as you think you are. If you're at all a human, it's going to take its toll.
I can remember going in my first COVID positive room and saying, please let this go well. And I was very afraid. Immediately, that went away. It went away because she needed me to be there. And I went back every day until she passed.
It took a lot of courage for everybody to show up every day and battle this virus.
I feel like there is going to be a turnaround.
I could not have done this without my coworkers. We did a lot of crying together, a lot of laughing together. We spent a lot of hours together.
Lots of other people walked through these doors every day, and we did it together.
We just worked as a team to get through it.
Honestly, it was the best teamwork I think I've ever seen.
All of us coming together and being a team has been really amazing to watch.
All we had to do was really take care of the patients.
Everyone working as a team certainly makes that easier.
Over time, we started to get more comfortable. We kind of knew what was needed, how to do it, and then react right away. When we started to see less cases and more people leave.
That's when I felt a sense of hope.
I know we will make it through this.
I have always had a lot of faith in people, but this is verification that people are tough. And this hospital, the hospital employees are tough, and everyone did a really good job of taking care of everybody in this community.
After this, we can get through anything.
You know, sometimes you wonder when you take care of people, you know, someday I hope when I get sick, somebody will be there for me, and they did. It worked. I am grateful to be here.